Kirsten, hello. I've
Hello.
looked at your daughter's X-ray and CT scan images. She has the condition which we call craniosynostosis. As we suspected, the images show that her suture has fused prematurely.
Okay.
Babies have in their skulls openings which we call sutures. The brain triples in size in the first year and it continues to grow after that till they're about 12. Tell me more about those symptoms.
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her. But I was sure something was wrong. She's in a lot of pain.
Yeah, she has craniosynostosis, but the shape of her skull is almost normal, so it was probably harder for doctors to diagnose that. Craniosynostosis is complex. Many doctors have difficulty detecting cases like your daughter's. As the brain is growing, it needs to be able to push the skull bones apart, giving it room to grow. If there's a fusion in the suture, then the growth is restricted and the brain is squeezed. That produces a condition we call intracranial pressure, which can be very painful.
So what are the options?
Well, we have to reduce that intracranial pressure, and that can only be done with surgery.
Surgery. That sounds really dangerous. My pediatrician said it could be fixed with a helmet.
If the sagittal suture hadn't fused, then we might be able to use a molding helmet, but that won't work at this point. Every surgery has several risks, especially head surgeries. Your daughter's otherwise healthy, and that's good. That means that there are not as many risks. So what we'll do is make sure and double check to see if she's got any heart conditions or lung conditions which might get in the way.
I'm really concerned. What exactly will this surgery involve?
Well, there are two options. We can go with the minimally invasive procedure or the traditional surgery. I'll explain the difference. With the traditional approach, we make an incision from one ear, going across to the other ear, over the top of the head. It's the only scar, and typically it's hidden by the hair. Once the incision is made, then the affected areas of the skull are removed. We create an opening for the brain to grow. We reshape those bones, place them back in a normal position. Once we're finished, the incision is usually closed using dissolving sutures.
This sounds really difficult.
It's a big surgery. It involves the expertise of a number of different specialists.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's no guarantee that the pain will be gone completely. With some children, there's some residual pain that can be controlled with medication. In some cases, we have to do another surgery, but that's rare because the success rate is very high. It's over 98%. We've been doing this procedure for years successfully.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So what about the other procedure, the minimal one?
The minimally invasive endoscopic surgery is one we usually perform when the baby is young, typically younger than 6 months. We use an endoscope to open the suture. It takes about an hour. She'd have to spend one night in the hospital. She could probably go home the next day. She'd have to wear a helmet after that for about 6 months. We'd have to check in every 3 months to make sure that the sutures weren't closing prematurely. It's a simpler procedure, but it can be equally effective, especially when the baby's very young.
Okay. Is the helmet painful?
It's not painful, it's custom made. Success of that procedure depends on how frequently the helmet is worn. We know after about 6 months if the growth was normal. If not, we might have to do another surgery. That second surgery would be the longer traditional one. Both types are complex. We have to work with a team. My team includes a plastic surgeon and neurologist.
This is so overwhelming. How do I decide what's best for Jenny?
A lot to think about.
You're sure she needs surgery? The helmet alone won't work.
She has fusion, and the only way to correct it is with surgery.
Okay. How do I get more information?
You should probably talk to your pediatrician. I can give you a pamphlet, though, that's got information about the condition and your treatment options.
Okay. Thank you.